So what I wanted to do today is to go over this PowerPoint presentation, which is kind of it's not necessarily in our textbooks, it's information that we've talked about previously, but it's a kind of a central location for all of it. And it coincides with the lecture that we just went over, but it's going to break down specifically like more what's going on when, so to speak. So basically what we want to talk about is this, I think, is another good way of looking at like what's going on when. So this is basically the phases of healing kind of in a different way, meaning that this inflammatory phase is the acute phase, and it really makes up 10% of the phases of healing. And so remember, the acute phase is kind of that beginning onset pain and inflammation that's followed by the reparative phase. The reparative phase is that also the proliferative phase, where our body's trying to lay down more tissue, remodel what we have, trying to make it look like the stuff that's around it. And then the remodeling phase is, again, that kind of intensive phase in which our body continues to remodel tissue in response to any stimulus that we put to it. And so what I like about this particular picture is that it shows how these are not mutually exclusive phases. There's some overlap in all of the phases. So the acute phase to the subacute phase, there's a bit of an overlap. From the subacute phase to the chronic phase, there's a little bit of an overlap. And that, as we kind of progress through these, majority of our time is going to be spent in the remodeling phase, this kind of chronic end-stage healing process in which our bodies are going to spend some time making the healed tissue look like the rest of its surroundings. So if we look at specifically the different kinds of tissue, so if we look at epithelial tissue, or wounds, if we look at skeletal ligaments, if we look at muscles, if we look at bone, if we look at cartilage, there's going to be some different things that happen in each of those tissues depending on what phase of healing that we're in. And so I don't expect you guys to memorize these charts verbatim, but I think it's important to kind of file away in your database, so to speak, so that when you're working with a patient, you can kind of better understand where they might be along their journey and while they're healing. And so, if we're talking specifically about wounds, when we have a wound, there's lots of phases for this. There's that initial inflammatory phase. There's going to be a reparative phase, which is, in some, is the granular phase. And then there's going to be a scar formation or maturation phase, or the remodeling phase. And so, specifically, if we're going to be working with patients that are in the hospital, bed positioning, pressure sore relief, things of that nature are very critical and important. And when those don't work the way they're supposed to, when you get breakdown of skin or you get breakdown of tissue, and a person ends up with a wound, like what's the normal progression that should go through so they can heal and they should have restoration of that tissue. So the action is basically what's going on in each of those phases. And then the time frame kind of gives you a more specific breakdown of what's going on. So, when you initially have a wound or an injury to the skin, there's that coagulation phase, which happens immediately, can last several minutes. The inflammatory phase, which is basically the edges of the epidermis begin to thicken within the first 48 hours. The entire wound is epithelialized, meaning that there's a tissue that's spanning across it to stop the bleeding and scar it down. Granulation phase, this is when fibroblasts start to appear in the first 2 to 3 days and are dominant by day 10. So they're working to lay down that network so that the skin can grow back across. And then you have the scar formation in the maturation phase. So that can last anywhere from weeks to months, even up to 1 year. So while this is not important per se for all of our patients, think about it in terms of when you have a patient that has a wound, whether that's a bed wound, a bed ulcer, or a post-op wound, whether that's arthroscopic holes, whether that's an incision for a knee, or a hip, or what have you. There's some things that are happening to that skin, to the surfaces, or tissues underneath that surface, where we need to keep those in mind and think about them a little bit more, about what's going on in the tissue. Tendons are very interesting structures because they go through their same reparative phase as well. But remember, there's a lot of stuff that happens when you strain muscle versus when you sprain a tendon. So when you sprain a tendon, there's lots of different things that happen in the beginning, where you get vasodilation, you get a hematoma that kind of bridges that tendon and causes a defect or a gap or fills in the gap. There's lots of activity of cells to kind of help provide inflammation and swelling so that we don't generally use the joint. That can begin immediately or last minutes to hours. There's the proliferative phase here where, again, fibroblasts are the general cells that are the most important functioning cell in that phase, where they're going to lay down collagen or tissue. And then the remodeling phase is kind of towards the end. But note here on the side that like fibroblast activity can last 1 to 6 weeks post-injury, or it's happening 1 to 6 weeks post-injury. And so think about our healing times for tissues, right? Tendons take anywhere from 4 to 6 weeks, 6 to 8 weeks to heal. And so, you know, we have to keep that in mind. And why, like, you know, re-injury of tissue can happen well within the remodeling phase if we stress it too much, because it's still getting broken down and strengthened. Here's a good picture of what musculoskeletal grades look like. So musculoskeletal injuries, and when we have muscles that are torn, we have a normal muscle here on the left-hand side and the different grades. So all the way from micro tears to partial tear to complete tear or rupture of a muscle. So when muscles are injured, how do they heal? It's pretty much all the same. It can begin immediately and last hours to minutes in this inflammatory phase. The proliferative phase can last 1 to 6 weeks post-injury, in which we have neutrophils and macrophages going in. And then towards this end, this remodeling fibrosis phase, there's a lot of collagen synthesis and increasing the density, and usually get scars. This is also where you have to worry about myositis ossificans, or heterotropic bone formation, is generally in this remodeling phase. And so, you know, that's something that I know you guys have talked about before in other classes, and it's important to remember. This is kind of what skeletal ligament injuries look like, where we have a micro tear, a partial tear, and a complete tear. So think ligamentous injuries that we're going to spend some time talking about next week when we talk about upper extremities, and when we talk about the lower extremities, we'll talk about these specifically. But there's lots of things that happen here, and note a recurring theme that it's generally about 6 weeks for a lot of this stuff to heal. And then afterward, there's up to a year where that tissue is still trying to be remodeled and trying to look like the rest of the tissue around it. Peripheral nerves, remember there are 2 important things here. There are 3 neural injuries that Dr. Evans has talked to you guys about, you know, all the way from neuropraxias to axon nemesis. But remember that you have Wallerian degeneration and axonal regeneration. Make sure if you don't understand those, to go back and look at those, because I'm not going to spend a lot of time talking about them. But just know that when you have a nerve injury, it's going to take a while for that nerve to wake back up. We'll speak specifically about this on Wednesday when we talk about spinal injuries and spinal issues, in terms of, you know, working on these patient populations and working on, like, okay, so you had somebody who had a cervical radiculopathy, they've had it for a year, they've gone and had surgery, and now they still have numbness and tingling in their arm after the surgery. Why is that? We'll talk about those kind of things. Here's a good picture for you guys in terms of talking about, okay, initially after a bone fracture, what happens? There's a hematoma that forms, there's a fibrocartilaginous callus formation that forms next, then there's spongy bone, the spongy bone then becomes compact bone and heals depending on where the injury is. So there's those stages of repair: the inflammatory phase, the soft callus phase, the hard callus phase, and the remodeling. Which again, note the common theme here, 4 to 6 weeks is when you get that hard callus. And so when you throw the x-ray up, or when the physician throws the x-ray up, that's when they're going to say that the bone is radiographically healed. And so that means that we can start mobilizing the patient, working them here in this phase. It's also where you want to be careful, because that's when you can start getting non-unions or refractures of bones. So you want to be careful in this phase. Much less than this phase, where the bone is still loose. It's a non-union fracture at that point, so you want to be careful. And look here down at the bottom of this particular slide, six weeks to a year. Again, a recurrent theme that you'll see in all these charts is that it can take up to a full year for us to fully remodel our tissue. When we talk about articular cartilage, remember articular cartilage is hyaline cartilage. It's the most abundant cartilage we have in our body. It's not innervated and it's not vascularized. It gets its nutrients from the synovial fluid that's around it. So it's really good at adapting to compressive forces, but not great to shear or twisting forces. And so when we get to the lower extremity, we're going to spend some time talking specifically about articular lesions and different ways that we rehab those and treat those. But there are zones that are set up for our articular cartilage. And so the blue dots are the chondrocytes, the lines are collagen fibers, but you have a superficial zone, intermediate zone, a deep zone, this line, and then cartilage, okay? So remember, chondrocytes are the specific cells in our body that make cartilage, and these different zones are, some of these zones can heal and some of these can't. And so if you think about it, the superficial and intermediate zones really can't heal themselves because they rely on diffusion in order to get their nutrients. This deep zone can heal some, but it's very difficult for it to heal because it's working on passive diffusion of nutrients from the bone in the subchondral area. And so take some time, look over those slides. It's important not to memorize all the details, but just understand common themes. So regardless of the injury, there's going to be an inflammatory process that happens in the front end of the injury, and that's going to cause pain and reduce range of motion. So our goals as therapists are to work on mitigating that. In that subacute or proliferative phase, our body is laying down additional tissue and structures in order to heal the injured site. And so, aggressive range of motion, aggressive strengthening exercises in that particular phase aren't warranted because you're going to put unnecessary stress on tissue that heals. You want to give the tissue plenty of time to lay down what it's supposed to, because during that subacute phase, it's very susceptible to re-injury, whether we're talking about tendons or muscles or ligaments. And then, excuse me, that final phase is the remodeling phase. It's when our body is spending the greatest amount of time making the tissue look like everything around it. And so we want to appropriately load the tissue and stress the tissue in a way that it causes it to lay down more tissue, but not to the point that it's going to cause a re-tear, re-injury, or retard the healing process. So, look over those charts. We'll talk more about them on Wednesday. Specifically, if you have any questions, make sure you pencil those in. You have homework assignments due on Wednesday. We'll also have a quiz at the beginning of class on this material, so make sure you watch these videos. Go back and review them a couple times if you have questions. And that's all I got. So I'll see you guys on Wednesday. Hope that you have a good day off because, it's President's Day. So I'll see you guys on Wednesday. Have a great afternoon.